If you're dealing with chronic pain and inflammation, you might think the only option is popping pill after pill.
But patients and doctors are raving about something else, a laser.
Yeah, Dr. Lisa Staudt is with Relief Care Chiropractic and Papillion Laser Therapy. Good to see you, doctor.
Hello.
Yeah, we're talking about something a little bit new this morning, the MLS laser.
Yes.
Right, what is it? What does it do?
Well, it's a revolutionary treatment that doctors all across the country have been using for the last few years. And it's great because it's almost like a magic wand, we call it in our office. It's just amazing some of the things that we have seen. But it's basically two synchronized wavelengths of light that come in and trigger the cell and stimulate it to reduce pain, to reduce inflammation, speed the healing process. And we've just seen almost miraculous results in people that have maybe had debilitating pain for years.
As we look at this unit here live, well, not live, but it's working on an actual patient. What areas does it target? And I guess, you know, what type of conditions and what type of inflammation and pain does it treat?
Exactly. It treats a wide variety. Right there, working on a low back, and that's actually someone that had a disc condition and low back pain. Sometimes it's arthritis that we'll see. That could be arthritis in the back, in the knees, the shoulders, a variety of joints, tendon issues, acute sports injuries. Those we've worked on high school kids and getting their ankles back, you know, in 2 or 3 treatments, boom, their pain is gone versus 6 weeks of pain with the ankle. We're looking at chronic shoulder injuries where someone they've got frozen shoulder and can't raise their arm up. I've had a lot of neck pain that, you know, just isn't responding to some of the things that we normally do, but they need to go the next step, or a headache that's a different type of headache that chiropractic's usually dealing with. The list goes on and on. If there's neurological conditions, that someone's got peripheral neuropathies, chronic wounds that aren't healing with diabetics, that they have an open wound, it will actually heal and help heal those tissues.
Well, when you think about pain and inflammation, people will try just about anything, right? And this is a non-invasive way to address some of those issues.
Absolutely non-invasive. The patient doesn't feel a thing. Very few people go, ooh, I can feel something happening, and it's like the cells or something's good in there. But there's absolutely 0 side effects to this as well. So it's amazing that we can help people, no side effects. Usually 1 to 3 treatments, someone is noticing that something's changing. Oftentimes on the first visit, they'll tell us something's happening.
How do you know if somebody's a good candidate for this?
Absolutely. I sit down with them and I do a consultation, and we talk about their history, what they've had going on, what they've done for it. I explain the laser to them, and you know how we would go about it. In their case, if it is an acute condition, you know, it may take 3 to 6 treatments. If it's a little more chronic, over 2 to 3 months, it might take, you know, 10 to 12 treatments. But sometimes we get permanent results. Sometimes we need to do some maintenance afterwards. But we just sit down and talk with them and look at their history, and you know, I can tell them if I've worked on people or if it's something that I've got experience in looking up on that situation too. There's tons of research studies out there.
Well, it may vary how many treatments you need, but like you said, it does work. And we want to take a second to listen to what some doctors and some of the patients are saying about this treatment. Take a listen.
It's probably the most transformative modality to come down the medical pathway in the last 50 years.
90% of our patients are achieving almost 90% relief of their symptoms, which is unheard of.
And it's going to revolutionize the way patients are taken care of.
I'm getting amazing results, and I can't wait to send other people in here to get the same benefits from it.
Even throwing a football, I can throw a football a lot better now than I could 2 years ago.
Within 5 minutes, the pain was gone, and I never had to have another treatment on my elbow again.
Even now, after several months, I have no pain in my knee.
Well, I can't throw a football at all.
Oh, I like that guy. I can throw a football better.
Still doing it at 75.
So you mentioned that the number of treatments depends on the condition and how severe it is. How long do people actually have to go in for the treatment? How long are they under that laser? Is it 5 minutes? Is it 30?
It's about 15 minutes or so. I do have some patients that once they come in for their shoulder, they're like, well, gosh, that knee's hurting me too. Can I do 2 areas at once? I'm like, we can do 2. We can't do more than that because of energy into the body. And we want you to get good healing. But if that's the case, if we're doing 2 areas, 30 minutes, 15 for 1. And you know, it depends. We'll try to do those a little more frequently right in the first couple weeks, and their treatment may range from 4 to 8 weeks, you know, just depending on the patient.
Yeah, there are some patients that maybe come in that this type of treatment just won't work for, or won't make good candidates for this?
You know, I screen those, and very few that I have found, and I'm agreeing with that doctor. 90% of the people are getting results, maybe even closer to 95. I don't think I've had one that hasn't had significant changes, but if there's someone that I'm leery on, I will be upfront with them and say, you know, we could try it, but we may not
get the results.
But with anything in medicine, there's You know, not everything's going to work, but this is a very high probability of helping with debilitating chronic pain.
What about potential side effects? Are there any?
There are absolutely no side effects with this laser. It's very safe. I don't know if you can see it from the video, but it moves. The head moves on it, so it keeps the energy from the laser moving at a constant rate. There's
so
some
it's not
lasers,
just like
it's not going
lasered
like
in
that.
on one little spot.
Yes, there's different types of class 4 lasers, but this is the highest advanced one, and then it keeps moving. Otherwise, you would have to move it by your hand, so you didn't create a burning in the patient. But this one is synchronized and is absolutely amazing.
What is the process to get started with something like this? I mean, depending on what, maybe it's an injury, maybe it's a chronic pain that you've been dealing with for years. What's the process to get the ball rolling?
Yeah, I would just say I'd love it if you call our office. We sit down and do a free consultation with them. I'll show them a quick video and consult with them on their condition. If they're looking at wanting to do an examination to say, hey, is this really for me further, I will actually have a special with the Morning Blend here that examination is usually $50 to $80. We're going to waive that fee for the people that see this on here. And then if it looks like something they want to go forward with, we'll discuss treatment option with them for there.
Okay, you talked about the initial consultation, that's free. Yeah. The exam's free if you move forward with the laser therapy. And then also you have this free ebook on MLS Laser and Health and Nutrition. What's that all about?
Yes. If someone's just interested in getting a little more information on the laser and what I do in general, I do a lot of things with nutrition. I've been on here in the past for weight loss, so a lot of cellular healing, things that are going to bring your body to a healthier state. And so that ebook is just going to give you some of the top supplementation, some of the top things to do with foods, how laser and energy can heal the cells. So, you know, they can always go to our website on drlisastaudt.com and enter in there that they would like more information on that ebook. Call our office if they would love to make a consultation appointment, and would love to sit down and see what we could do to help people.
Yeah, you made the web address easy too, drlisastaudt.com, very easy. And you've helped, like you said, you've helped a lot of people with weight loss too. We'll talk about that next time you're on.
Yeah, sounds great.
Good to see you, Doctor.
Good seeing you guys.
Thank you. Thank you so much.
Welcome.
So our friend John